The nurse assesses a 40-year-old client with acromegaly in an outpatient health clinic. Which new finding is most important to report to the healthcare provider? 1. Complaints of knee pain when walking. 2. Dark leathery skin. 3. Fasting blood glucose 126 milligrams, DL 7.0 mol L. 4. Presence of S3 and S for heart sound. Correct. 4. Acromegaly is an uncommon condition caused by an overproduction of growth hormone GH. It is usually due to pituitary adenoma and onset in adult clients, generally occurs at age 40 to 45. In an adult, increased GH results in overgrowth of soft tissues of the face, hands, feet, and organs. Additional heart sounds S3. S for require further assessment for cardiac conditions, e.g., heart failure. The nurse is performing an initial assessment on a client diagnosed with Addison's disease. Which assessment findings should the nurse anticipate? Select all that apply. 1. Acanthosis nigricans. 2. Hirsutism. 3. Hyperpigmented skin. 4. Truncal obesity. 5. Weight loss. Correct. 3. 5. Addison's disease or chronic adrenal insufficiency occurs when the adrenal glands do not produce adequate amounts of steroid hormones. Symptoms include weight loss, muscle weakness, low blood pressure, hypoglycemia, and hyperpigmented skin folds, buccal area, palmar crease. Hyperpigmented skin is a characteristic universal finding. This results from increased adrenocorticotropic hormone, which is due to a decrease in cortisol negative feedback. The nurse educates a 30-year-old female client who is being evaluated for hyperthyroidism with a radioactive iodine uptake (RAIU) test. Which instruction S should the nurse include in the teaching plan? Select all that apply. 1. A pregnancy test must be obtained prior to RAIU test administration. 2. All jewelry or metal around the neck area should be removed before the RAIU test. 3. Anti-thyroid medications should be held for 5 to 7 days before the RAIU test. 4. Conscious sedation will be used to help with relaxation during the RAIU test. 5. It is important to refrain from eating or drinking for at least 12 hours before the RAIU test. 1 to 3. A RAIU test involves administering a low dose of radioactive iodine, in contrast to radioactive iodine treatment for some types of thyroid cancer, which uses a high dose to destroy all thyroid tissue. The thyroid gland is the only tissue that uses iodine, which is a key component of thyroid hormones. A scan is performed at 2, 6, and 24 hours to assess the areas actively absorbing iodine, which can narrow the diagnosis to hyperfunctioning thyroid disorders, e.g., Graves' disease. The nurse is caring for an adolescent client diagnosed with type 1 diabetes. The client exhibits hot, dry skin and a glucose level of 350 milligrams, DL 19.4 mol, Vel. Arterial blood gases show a pH of 7.27. Stat serum chemistry labs have been drawn. Cardiac monitoring shows a sinus rhythm with peak T waves, and the client has minimal urine output. What is the nurse's next priority action? 1. Administer for regular insulin. 2. Administer normal saline infusion. 3. Obtain urine for urinalysis. 4. Request prescription for potassium infusion. Correct. 2. This client has diabetic ketoacidosis (DKA). All clients with DKA experience dehydration due to osmotic diuresis. Prompt and adequate fluid therapy restores tissue perfusion and suppresses the elevated levels of stress hormones. The initial hydrating solution is 0.9% saline infusion. The nurse is conducting a health screening clinic at an industrial work site. The nurse should be most concerned about which client's risk for metabolic syndrome. 1. 27-year-old woman with triglycerides of 210 milligrams per deciliter, 2.4 mmol, blood pressure of 128/80 seconds of a millimeter Hg, and fasting blood glucose of 98 milligrams per deciliter, 5.4 mmol, 2. 45-year-old man with waist circumference of 38 inches, 96.5 centimeters, high-density lipoprotein of 49 mg per deciliter, 1.3 mmol, and fasting blood glucose of 118 mg per deciliter, 6.6 mmol, 3. 55-year-old woman with waist circumference of 37 inches, 94 centimeters, triglycerides of 190 mg dl, 2.2 mmol, and fasting blood glucose of 120 mg per deciliter, 6.7 mmol, 4. 82-year-old man with high-density lipoprotein of 45 mg per deciliter, 1.2 mmol, blood pressure of 148/88 of a millimeter Hg, and fasting blood glucose of 104 mg per deciliter, 5.8 mmol. Correct. 3. Metabolic syndrome is the presence of 23 metabolic health factors that increase a client's risk for stroke, diabetes mellitus, and cardiovascular disease. Criteria include abdominal obesity, waist circumference 240 inches 100 centimeters in men, is greater than or equal to 35 inches 89 centimeters in women, high serum triglycerides greater than 150 milligrams DL 1.7 mol, AL or hypertriglyceridium drug treatment, low levels of high-density lipoprotein HDL cholesterol 40 milligrams DL 1.0 mol, L in men, 50 milligrams DL 1.3 mol in women, hypertension 130/85 of a millimeter Hg or hypertension drug treatment, fasting blood glucose 100 milligrams DL 5.6 mol, AL or hyperglycemia drug treatment.